So first, go to the table of contents in the CPT PCS book. Table of contents you can open. Here under Appendix A, you get approach table. Appendix A, we have the approach table. So if you go to the approach table, you will get total 7 approaches. External, open, percutaneous endoscopy, via natural or artificial opening, via natural or artificial opening endoscopy, via natural or artificial opening with percutaneous endoscopic assistance. Okay, these are the approaches, 7 approaches. So in these 7 approaches, any one approach they will use to perform a procedure. That we need to find which approach they used. So come to the first, external approach. External value should be X. External means skin level. Okay, they will
Sir,
perform
yesterday
the
itself we learned this.
all this covered. Huh?
Yes, sir. Last one alone.
Percutaneous endoscopy.
Not covered.
No.
Tell for once.
All are not covered, sir.
From the 4.
Actually, not covered, just overlook.
I asked to read all of this. That's it, right?
Yes, sir. You asked to
Yeah,
read
yeah.
only.
No issues, I
Yeah.
will.
Once again told.
So first thing, external skin level. Okay, here they will perform the procedure on the skin directly or indirectly applying the pressure. Okay, directly perform on the skin or indirectly they apply the pressure on the skin. Okay, it should be external. Here they don't cut the skin. Okay, they don't puncture, they don't cut, nothing. Directly they will perform on the skin or indirectly apply the pressure like electric shock waves, like pressure casting, splinting. Okay, then skin level procedure, skin level laceration, skin level debridement. Okay, or if you open the mouth, what are the body parts visible? If they performed, it also external. Okay, if you open the mouth, what are the body parts visible? If they perform the procedure, that also external approach. Okay. So next approach, open. Open means here they will cut the skin or other layers. Okay, direct and indirect application. Okay, like visible in the mouth also. Procedure performed with an orifice structure that are visible without the aid and any instrument are coded as open approach. If what are the body parts visible in the mouth, that also considered as external. Next come to the open. Open means simple. Here they will cut the skin or other layers and they will reach the procedure site and they will perform the procedure like normal procedure.
ఏంది ఏడి వచ్చినట్టుంది మనం ఫెడెక్స్ వాడు వచ్చాడు.
Okay, it should be open. So they will cut the skin or mucous membrane or any other body layers necessary to exposure the site of the procedure. They will cut the body layers and they will perform the procedure. It should be open. Clear? Next, percutaneous. Percutaneous means here they will puncture or minor incision. They will puncture our body or they will incision, minor incision. It should be percutaneous, like using the needle or catheter or guided wire. They will puncture the body and they will complete the procedure. It should be percutaneous endoscopy. Sorry, percutaneous approach, not endoscopy. Percutaneous. Note down, when we need to code percutaneous, needle, catheter, guided wire, puncture. If you seen this approach words, it should be percutaneous. Okay, if they use the needle like needle biopsies, administration of medication or blood transfusion, catheter insertion, guide wire incision, puncture like incisional drainage, centesis procedure, thoracentesis, paracentesis, removal of fluid or gases from the body. It should be considered as
Percutaneous.
percutaneous approach. Okay. So next, percutaneous endoscopy. Percutaneous endoscopy means visualization. Okay, for that instrument have the camera, they will insert in the our body and they will visualize in the monitor. Okay, we can get the video visualization you will get about the body part. Okay, it should be percutaneous endoscopy. They will puncture the body and they will insert the instrument. Puncture our body and they will insert the instrument. It should be percutaneous endoscopy. Note down what are the scopies comes under percutaneous endoscopy. If you find any procedure performed by using these scopies, we need to consider as percutaneous endoscopy. Laparoscope, arthroscope, thoracoscope. Guys, noted scopies.
Yes.
Next approach, via natural or artificial opening. So via natural or artificial opening. Natural means what are the natural roots in our body? Like mouth, nose, rectum, penis, vagina. Directly they will insert the instrument in natural roots. Or artificial external opening, which means already created ostomy, artificial external opening they used to reach the procedure site. It should be 7 via natural or artificial opening like endotracheal tube, Foley catheter, transvaginal circulage in the vagina, Foley catheter through penis, endotracheal tube insertion through mouth. So if they used, it should be via natural or artificial opening. Suppose in the natural route, they insert the scopy. In the natural route, they insert the scopy. It should be via natural or artificial opening endoscopy. So note down what are the scopies comes under via natural or artificial opening endoscopy. Colonoscope, bronchoscope, EGD, hysteroscope, cystoscope, sigmoidoscope.
సార్ పర్కుటేనియస్ ఎండోస్కోపీలో కూడా స్కోపీయే కదా సార్, అవి డిఫరెన్స్ ఏంటి సార్?
ఇవి హోల్ స్మాల్ పంక్చర్ చేసి ఇన్సర్ట్ చేస్తారు స్కోపీస్. ఇవి డైరెక్ట్ గా న్యాచురల్ రూట్ లో ఇన్సర్ట్ చేస్తారు. కొలనోస్కోపీ త్రూ రెక్టమ్, బ్రాంకోస్కోపీ త్రూ మౌత్, ఈజీడీ ఆల్సో మౌత్, hysteroscopy through vagina. In natural route, they will insert these scopies via natural or artificial scopy. These are, they will puncture our body. They will create a small hole and they will insert. Laparoscope or arthroscope, how they will insert? They will create a small hole or puncture in our body and they will insert the scopy. So it should be open. They will cut and perform. Next, percutaneous puncture. Okay, like this they will insert the scopies. Okay, puncture and they will insert the scopies. Suppose you can go for any laparoscopy or arthroscopy instruments. like this. This is the instrument they will insert in the body directly. Okay. This is the scopy. They will puncture and they will insert. Suppose colonoscopy means directly they will insert in the rectum. This is directly insert through rectum, natural route. Here they are not puncture any body part, or they are not creating any hole. For both scopies have visualization video. How they are approaching, how they are inserting the scope. Based on that, you are getting percutaneous endoscopy and via natural or artificial opening endoscopy. Last route of approach. Here, two approaches they are using to perform a procedure. 4 and 7. Okay. Percutaneous endoscopic assistance and via natural or artificial opening. These both approaches they use to perform a single procedure at a time. It should be via natural or artificial opening with percutaneous endoscopic assistance. Via natural or artificial opening with percutaneous endoscopic assistance. They will use via natural and artificial opening route and percutaneous endoscopy approach route. Both routes they used. Here mostly will get female reproductive system related procedures like laparoscopic assisted open salpingo-oophorectomy, resection of female reproductive system. Okay, only female reproductive system related will get here. So they will take natural route and insert the scopy in percutaneous. Two approaches they are using. It should be via natural or artificial opening with percutaneous endoscopic assistance, EF. To go through these approaches, I will give the mark question, practice questions now we can practice. Read once.
Sir, I have a doubt. Sir, in natural or artificial opening, 7, you said that mouth can also be used because it's a natural opening, right? And
Yes.
in the first one, external also, we were using procedures in the mouth. So how can we differentiate?
Mouth, what are the body parts visible in if you open? Okay. Mouth, by using the insert the instrument through where? Through lungs, through intestinal directly. Okay.
Okay, so to reach the site, we are using the mouth to reach the procedure site. In external, the
Correct.
procedure will only be in the mouth, right?
Correct.
Okay,
What are,
got
that
it.
also visible parts, not all the parts. Only if you open mouth, what are the body parts visible in the mouth? If
Okay,
they done
teeth,
procedure
tongue,
for
like
that,
that.
tongue,
Okay,
teeth, what are
okay,
the
okay,
things for
okay,
that?
okay.
Clear? Here check if you want for external procedure performed within our orifice structure that are visible without the aid of any instrumentation, which means if you open.
Okay.
So read one more time all the approaches. It was very important in the PCS code identification, guys. So one more thing, that scope is do not forget and do not confuse. When we need to take 4, when we need to take 8. Based on that, you can easily eliminate the options. Okay. Noted, right? Scope is.
Yes, sir.
Thank you. Now we can go with the some practice workup based on the scope is. So first question, check just, okay, we are not going to lead a complete code, so don't ask me what is the answer like that. Just we are discussing approach. During a cholecystectomy, the gallbladder is completely removed using a laparoscope approach. What is the appropriate code? Okay, this is the
Or
question. Wait. This is the question. Please unmute everyone. So this is the question. Then you will get, please mute everyone, guys. Don't unmute unnecessarily. If you know the answer, just wait. Otherwise, I don't share the link for previous batches if you are unnecessarily telling the answers. Just listen. So they given 4 options like this. Okay, first we need to check which character they are changing in the code, 5th character. If they given 5th character, all are same option. 5th character, they given all are same options. So no need to look for the approach because they given same approach in all the options. So what is the use of approach? Correct? If they given
Yes.
4 options, suppose for example, they given like this, all 4 options, 5th character should be same value, 4 4 4 4. Now is there any necessary to check the approach?
No.
Not required because they are saying same approach. Now what is the use then if they given different approaches? Based on the approach, we can easily eliminate the options. After identifying the approach, you can easily eliminate the options. What approach they are using here?
Percutaneous.
Percutaneous endoscopy.
Percutaneous endoscopy.
Cutaneous endoscope.
Endoscopy. Laparoscopy means percutaneous endoscopy. So what is the value for percutaneous endoscopy?
4.
4.
Oh,
You need to remember the values, okay? X external open 0, percutaneous 3, percutaneous endoscopy 4. Like this, we need to mug up the values. Okay, easily we can eliminate. So we can eliminate B and C, right? Easily. Now,
Yes.
just A and D, you need to check, you will get the answer. So which 5th character, if they given different numbers, different approaches, find the approach first. Easily you can eliminate the options. Everything should be optional in exam, guys, either multiple choice or case study. Everything should be optional. No need to lead directly code. If you understand how to eliminate the options, you will get. Rather than the book leading, rather than the practicing all the things, don't go blindly. Just use smart work. Just eliminate. Find the approach. Eliminate the wrong approaches options. Now, you can find the code based on the remaining characters. Third question answer, tell me.
Percutaneous.
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 Percutaneous, correct? Next, what is the 7th character in PCS code used to identify?
qualifier.
Qualify. What is the body system character for the gastrointestinal system?
D.
Yes,
D.
D.
D should be gastrointestinal. 10th one.
Via artificial, natural, artificial opening.
Via natural or artificial opening.
Natural artificial opening endoscope.
C, right?
Yes.
Yes.
So see here, 15th question, they given all are same options, right?
பொண்ணு அந்த கூட்டார்
See here, they given all are same options in the fifth character. So no need to check the approach, correct? 0 means they used open. That's it. No need to check any approach. Okay, what? Suppose here find the approach. 16th question.
Percutaneous.
Percutaneous.
Percutaneous, 3, right? They are clearly
Percutaneous.
saying percutaneous insertion. See, one option only they given percutaneous. Remaining 3 should be 0. If you identify percutaneous, you are getting the answer right. Option B correct. That's it, na? Yes or no? Only one option they given, fifth character 3. Remaining all are 0, 0, 0. But percutaneous they used. Which option fifth character have 3? That should be the answer. So here we have only one option. Got it?
Yes, sir.
Thank you.
సార్ అక్కడ క్వశ్చన్ లో ఓపెన్ అని పర్కుటేనియస్ అని ఇవ్వలేదు కదా సార్.
ఇంకెందుకండి అన్ని ఆప్షన్స్ 0 ఉన్నప్పుడు మీరు అప్రోచ్ ఎందుకు చెక్ చేస్తున్నారు? అదే కదా నేను చెప్పింది మీకు. While they given all the options 0 are same, then why you are looking approach? Why what not mentioned, that mentioned, this mentioned? Why we are wasting time?
Option C.
C.
Option C. 24, 25.
Option B.
Option B.
Option
Option B.
25.
25.
B.
B.
Option B.
26.
E.
X.
B.
External.
External. External.
So now you get idea, right? About approaches. Clear? Next, can we
Yes.
move to the next character? Sixth character. What is the sixth character? Device. Sixth character should be device. Device means what is the meaning of devices, guys? Generally, device remains in place after the procedure is completed. Okay, it should be in our body after the completion of procedure, like external appliances. Okay, it should be device. Suppose what device they are using, we need to check. Based on that, we will get the code. But what are the things we need to consider as device? What we should not consider, we can check here. They given see graft, prosthesis, surgical implants, simple or mechanical appliances, electronic appliances should be considered as device. Clips, ligatures, sutures, surgical drains, instrument to visualize the procedure site, which means scopies. These we should not consider as device. Why we should not consider as the device, suture?
They are not within the
They
body.
will remove after completion.
After they will remove, right? It was not permanent in our body. Instrumentation of the visualization procedure site, scopy also. After the visualization, they will remove the scopies. Clips, ligatures also they will put for the support. Okay, it will be remains in our body. That only scopy. Okay, that only we need to consider as device. It will be remains in our body. Then only consider as device. So grafts like bypass grafts and all, central venous catheters, then prosthetic joints like hip replacement joint, knee replacement joints, surgical implants, simple or mechanical appliances, electronic appliances like pacemaker, simpler mechanical appliances like rods, screws, okay, bone fixation devices. These all we should consider as device. So remember, for every procedure we don't get a device. Okay, for every procedure you don't get a device. Suppose if they want to remove any body part, is there any necessary to place a device?
No.
Not
No.
required. Whenever they place the device, we need to go with device. Otherwise, we will get no device option while you are leading the code. You will get no device option. Okay. If they placed a device, based on that, we need to go with. They place the device, they not mentioned type of device. They place the device, they not mentioned type of device. Then we need to go with synthetic substitute as the default device. Okay. Synthetic substitute as the default device. Then autologous device means
From self
From the
body.
same person.
self, okay, are taken the sample from the same person and harvested and they placed. It should be autologous. Non-autologous means from
From other
other
person.
sources, like
From
other person or banks,
crafting brand.
graft bone bank, grafting banks or other person donated. It should be considered as non-autologous. Okay, remember bank bone grafts, bank grafting banks, you will get non-autologous. Okay, blood banks, grafting banks and all comes under non-autologous. Self autologous, if they not mentioned, synthetic substitute as the default type. These three things remember. And what we should consider as device, what we should not consider as device. Clear, right?
Yes, sir.
Thank you. Next, qualifier. Note the qualifier as a specific meaning for each root operation. There is no specific definition for qualifier. It was based on the root operation. Okay, for each root operation have a specific qualifiers. For each root operation have a specific qualifiers. Qualifier as a specific meaning for each root operation. Here also, guys, for every procedure we don't get the qualifier. If they are not mentioned any qualifier, we need to go with no qualifier. Okay, we are go with no qualifier option. If you are not getting qualifier, if you get the qualifier, we need to go with qualifier. So here they mentioned qualifiers. Note down this: destination for peripheral bypass, origin of coronary bypass, cemented or uncemented in the replacement, diagnostic in extraction, excision and biopsy, drain, vertical in vertical sleeve gastrectomy. Okay, it should be root operation qualifiers. Okay, these are the root operation names: bypass, replacement, excision. Okay, we need to take these approaches, qualifiers. I will explain at the time of root operations. Qualifiers also simultaneously we can discuss. Now you have idea about 31 body systems, correct?
Yes, sir.
7 approaches, body parts, devices, qualifiers, all you know. Now, root operations. Next thing. As of now, whatever we are discussing, this is the basics of the code structure. Okay. But exactly what procedure they performed, we are not finding as of now. You find just what is the body system, what is the body part, what approach they used, they placed a device or not, is there any qualifier or not. But what procedure they performed, what action they done, we should not identify right up to now based on the 6 characters except root operation. So root operation should be the most important character in the PCS code, guys. Whoever understand the root operation definitions, they will get the code. If you are unable to find the root operation, the code will go wrong. Because every procedure will get same approaches, same devices, same qualifier, same body system, same body part. But you need to find the exact root operation, then only will get a correct code. Total we have 31 root operations. So where you will find in the book, everything I am teaching in the ICD-10 PCS book, because while you are carrying the exam, you can check easily. Appendix B, check root operation definitions. After Appendix A, Appendix B, root operation definitions. If you go for this page, you will get value, root operation, definition, explanation, examples. Here we have 31 root operations, guys. For exam purpose, at least we need to learn 10 to 12 root operations. Okay. For exam purpose, at least 10 to 12 we need to learn. No need to remember all the 31. Just 10 to 12 you can learn and understand the definitions. Okay. So I am explaining one root operation. First, we are discussing easy root operations for better understanding. Then we can go for the complex one. First, note down everyone, transplantation root operation. Transplantation root operation. Value should be y. Put transplantation in bracket y. Transplantation means simple. If they transplant any organ, it comes under transplantation root operation. Okay. Transplanted any organ like lung transplant, kidney transplant, heart transplant. If they transplanted a organ, you need to go with transplantation root operation. Organ transplantation procedures you will get under transplantation root operation. Organ transplantation procedures. Clear?
Yes.
Now, come to the table of contents again, starting. One root operation complete. Okay, transplantation root operation complete, guys. Now, come to the table of contents. I am explaining how to find a complete code in the book, how to use the book. Because for at least one procedure, you will get idea about 7 digits. First, you will get ICD-10 PCS index here, correct? Check heading and ICD-10 PCS tables. These headers, everyone fine? In the table of contents, you find these headers or not? ICD-10 PCS index and ICD-10 PCS tables. Guys, please
Yes, yes.
ask me if you have
Yes.
any doubt. Okay, because once you understand the book leading, then very easy to find every code. If you are not understanding book leading, it was difficult for every procedure. Okay, first index, then tables. Whatever the given procedure, just we need to go for the index first. Index you need to go first. Then you need to identify the code. In index, you will get minimum 4 digit, maximum 7 digit. 4, 5, 6, 7 digit you will get, sometimes 7 digit, sometimes 4 digit. If you find 7 digit in index, no need to use the tables. If you get 4, 5 digit or 6 digit, you need to use the tables for remaining letters, remaining characters. So how to use the index? If you go to the index 51 onwards, ICD-10 PCS index. Index was like dictionary, guys. You will get A to Z. Okay, headings. Whoever know the dictionary usage, They can get easily PCS code in the index. So whoever know the use of dictionary A to Z, you need to lead just. Suppose they done transplantation, where you need to check?
Why?
Under T series, right?
Yes, T under T.
Under TRA you need to go. If you check in A series, you don't get anything. Okay, well? Which procedure they given, that particular heading you need to go first. So note down index usage, index leading. Okay guys, while you are leading the index, first identify the root operation in procedure. After identifying under root operation heading, look body part. Under root operation heading, look body part. Without finding the root operation, you should not able to use the index. Okay, without finding the identifying the root operation, it was very difficult to find a code. Compulsory we need to identify a root operation. If you are not able to find the root operation, you don't get the code. Clear? So now, if they done any transplantation procedure, first where we need to check?
Transplantation.
Under
Can't find it.
transplantation. Suppose they done lung transplant. How you need to go? Under lung you will check transplant, or under transplant you will check lung?
Under
Under
transplant.
The transplant line.
Under transplant lung you need to check. Don't go for lung and I am not finding transplant. Not like that. Under the procedure term you need to find the body part. First identify the procedure term, root operation. Under the root operation heading, find the body part. So I am going transplantation heading. T series. So under T series, TRA. In the top you will get, guys, what are the values, what are the numbers you will get on the particular page. Here therapeutic, TO up to transfer, transfusion, transplantation. Correct? Transplantation heading we can find.
Yes.
So now if they transplant any organ, here we need to check. Transplantation, bone marrow, face, esophagus. Here also they given check. And heart, intestine, kidney, larynx, liver, lung, pancreas, penis, scrotum, spleen. Okay, but are the body parts they transplanted? Here they given the body part names. Suppose if they transplanted liver, what is the character code? Fine. Liver transplantation, what is the code?
0FY.
0FY00Z.
0FY00Z, correct? 0FY00Z. Suppose right upper lobe lung. Right upper lobe lung.
0BY0Z.
Under lung, upper lobe right, 0BY0Z. Okay, like this, you need to find. Suppose pancreas, 0FYG0Z. Okay, spleen, 07YP0Z. Kidney, left to right, 0TY10Z, 0TY00Z. 6 digit you will get in index. Okay, transplantation procedure 6 digit you will get in index, because now Every transplantation they will perform through open approach only. We don't have other chance to perform the organ transplantation in like percutaneous endoscopy or colonoscopy. Every transplantation they need to perform open. For the transplantation of organ, no need to place any device. That's why you are getting 0Z, 0Z, 0Z. So 6 digit you are getting. Now you need to find the 7th character. Okay. How to use the tables we can discuss. Up to now, any doubt to identify the transplantation in index?
No, sir.
Thank you.
No.
Now,
Sir.
first note down liver transplantation example. Liver transplantation note down. This we can note down 0F500Z. We can go for this code range. Now, again we need to go for the table of contents. Here, under the tables, check 0F series where it was starting. Here you are getting 0F1 to 0F5.
Hepatobiliary system and
0F1 to 0F5. Here you will get. So you need Y. Y means you will get ending. First you will get 1, 2, 3, A, B, C, D, F, Y. So if you go to 367, you will get 0F1. If you go to 379, if you will get 0G2. But if you go previous page, you will get 0F5 easily. So I am going 379. 0FW still because it was a PDF page mismatch. 0FY. Here in the tables, guys, now listen how to use the table. You will get 3 digit in the top. Then they will give the table like body part, approach, device, qualifier. After identification of 3 digit, just come and check what is the body part they given in the procedure, what approach they used, what device. If we have only one approach, one device in the tables, default we need to take. There is no other option. If when we have multiple approaches, you need to look what approach they used. Suppose here check, we have the multiple approaches. We need to check what approach they used for the procedure. Here check, only one approach they given, then no need to check any approach. Okay. So whenever they given multiple approaches, you need to check what approach they used. Whenever they given the single approach, no need to check exactly what approach they used. Clear? Next. Seventh character, what you find here? Qualifier, allogenic, syngenic, zooplastic, correct?
Yes.
0, 1, 2. Up to 6 digit you are getting anyway in the index. Just you are finding allogenica, syngenica, zooplastica. That's it. So note down when we need to take allogenic, when we need to take syngenic, when we need to take zooplastic. Allogenic means any donor matched person donated, it should be allogenic. Suitable donor was donated, allogenic. If they taken from the identical twin brother or twin sister, transplanted from the identical twin brother or twin sister, syngenic. From animal, zooplastic. From animal zooplastic. Definitely they will give from where they taken. Okay, what? Definitely they will give in the procedure note how they transplanted, who was the donor. Without donor, they won't give. Some people will ask if they not mentioned allogenic, syngenic, zooplastic, what we need to do? You need to pend for the clarification. Don't code or don't complete. Don't take anything blindly. Definitely they will give from where they transplanted, who was the donor. Okay. Remember these 3 things, guys, enough. Okay, because no need to use the index also for transplantation procedure. No need to use the tabular list also for transplantation procedure. 6 digit you will get anyway in the index. Just you need to identify allogenica, syngenica, zooplastica. Allogenic 0, syngenic 1, zooplastic 2. 7th character. They will give the options, right? If you go for that options based on the tabular list, just to check allogenic means what, syngenic means what, zooplastic means what. If you understood, then you easy to find the code. Suppose they transplanted the liver from the identical twin brother. What is the complete code?
OF 0FY00C1.
G1. Okay, what 0F500G1. That should be the complete code. Now note down everyone case study. One case study will get in exam related to transplantation. Note down this case study. Patient coming with ESRD is on dialysis, performed left kidney transplanted from the brain dead person. Past medical history have diabetes. Assessment ESRD on dialysis. What is the PDX here?
DM with CKD.
DM with ESRD. Okay. When the patient have diabetes and diabetic complications, always go with E series sequence first. 11 2 2, 11 1, 3 series, 4 series, 5 series, 6 series. Okay. 11 series. Diabetic complications should be sequence first. Okay. Then complication, additional code. While you are coding diabetes with CKD or ESRD, we need to get two codes, CKD stage and diabetic kidney complication. First, what you will give, CKD stage or diabetic kidney complication?
Diabetic kidney.
CKD, DM with kidney complication. Remember, if even though they documented diabetes in the past medical history, we need to go with 11-2 complication only. Okay, what PDX? 11-2-2, you will get DM with ESRD, then ESRD and hemodialysis should be SDX. Procedure, they performed left kidney transplantation from the brain dead person. So, what is the root operation?
Transplantation.
Remember, guys, this is the paper explanation. Okay, well, note down. Don't take negligence. Transplantation. After under transplantation, left kidney. I am giving index leading also. Under transplantation, left kidney. You will okay?
Kidney left, no? Right.
Kidney left or left kidney, whatever. Sorry, kidney left. Kidney left. You get 0 TY 10Z in index. Table. 7th character. Just a 7th character identify enough now. 0. Allogenic. Brain dead person. Okay. So now everybody able to lead the transplantation, left kidney or not, check. Whoever facing difficulty to find a PCS code also check. After completing all the PCS class, don't text me, I am not understanding PCS leading, can you teach again? It was very difficult to me after completing all the things. If you're asking personally, there is no personal classes, okay? Whatever doubts you can ask me, you can resolve me, because I am giving the videos also. So there is no personal classes to person. This is the leading, guys. Okay, go for the transplantation. How you are find the kidney? Same, you need to go for the how to we use the liver now kidney left 0TY10Z. That also difficult means while you are carrying the original books for exam, put 0 here only. Beside of the code, simply put 0. Okay. For us, that also very difficult to remember. So put 0. 0TY10Z0. Easily will get. In index only take with pencil and write smallly 0. Okay. At least you can do that if you are not understanding how to go for the table for this case scenario. Any doubt transplantation? Any doubt transplantation route operation, guys?
Yes, sir.
సార్
No, right?
పీడిఎఫ్స్ కొంచెం ఎక్స్ప్లెయిన్ చేయరా సార్?
PDX was the diabetes and CKD complication. When the DM and CKD complications, what you will do? Tell me. Diabetic
డయాబెటిస్
complication.
అంటే కాంప్లికేషన్స్ వస్తాయి.
అంతే కదా, ఆడ కూడా ఉండేది 11-2 diabetic complication, then hemodialysis and ESRD should be SDX. Okay, one case study completed, guys. Remember, one case study completed for you. Next route operation note. Next route operation note. Go for that. Put heading excision. Excision. Excision B. Excision B. So excision means cutting out or off without replacement a portion of body part. If they remove a portion of body part, it should be excision. Okay, without replacement, they don't replace. If they remove a portion of body part, it should be excision. For portion of the body part means 90%, 99% also, not complete body part, or even 1% also remove, it should be excision. Removal of a portion of body part, it should be excision. Note down, if they perform any biopsy procedures, qualifier should be diagnostic, you need to consider. Qualifier should be diagnostic. If you seen any biopsy procedure like kidney biopsy, lung biopsy, liver biopsy, in the 7th character, what you need to take? Qualifier? Diagnostic. Qualifier should be diagnostic for all the biopsy procedures. For biopsy procedures, qualifier should be diagnostic. For remaining procedures, qualifier should be no qualifier. Because now while you are leading the excision procedure in the 7th character, you will get two options, diagnostic and no qualifier. So whenever they performed biopsy, we will go with diagnostic qualifier. Whenever they not use the biopsy, we will go with no qualifier. So for example, partial nephrectomy, liver biopsy. So note down the example of excision route operation. To removal of lump, polyp, mass, excisional debridement, biopsy, partial ectomies. If they done any removal of polyp, mass, lump, or excisional debridement, partial ectomies like portion of the removal, partial nephrectomy, or taking the one lobe, one disc in the lumbar or cervical or thoracic, portion of colon, sigmoid colon or ascending colon, partial removal of pancreas or liver, all the partial ectomies, excisional debridements, removal of a mass, lump, polyp, biopsies, you will get in the excision route operation. Noted?
Yes, sir.
Next, note down the resection route operation. We can practice together these two route operations because similar. Next, note down the resection. Resection means cutting out of without replacement all of your body part. Here also no replacement. They will remove all of your body part. If they remove portion of the body part, excision. If they remove complete or all of your body part, resection. That's it. Portion of the body part remove, excision. Complete body part remove. What is the route operation?
Resection.
Resection value T. Okay, resection value T. Now, note down the resection headings, examples. So, if they remove complete body part, remove entire body part, or in the lung, if they remove lobe also, okay, if they remove lobe also, it should be a resection. Like in the lung, if they remove complete body part of lung also, resection. Complete lobe also, if they removed in the lung or liver or thyroid, lobectomy also considered as resection. Remember, okay? Lobectomy also considered as resection. If they remove a lobe in lung or liver or thyroid gland, completely remove the body part or complete lobe removal also resection. Suppose they done left upper lobe lung resection or left upper lobe lung removal. What is the route operation?
Excision.
Resection. Complete lobe removal also resection or complete lung also resection. Then in the colon.
Sir, if it is only middle right lung, what is it?
Any lobe, not only lung. In any body part, if they're done lobectomy, in liver, thyroid or lung, any lobectomy.
Sir, if it is for complete one kidney,
That also resection. Complete body part or complete lobe. Complete body part or complete lobe.
A portion of a lobe may be excision.
Excision.
Right?
Yes. Portion of lobe should be excision default. Complete lobe only resection.
Yes. Thanks.
Next, in the colon, if they done sigmoid colon or ascending colon or transfer colon or entire colon or cecum, okay, if they removed also resection. Okay, complete colon or we have the parts in the colon, right? ascending colon, descending colon, sigmoid colon, transverse colon. In that, if they removed, also consider as resection. Each one we need to consider as body part here. Sigmoid colon separate body part, ascending colon separate body part, descending colon separate body part, transfer colon separate body part. Like that we need to consider. That removal also we need to consider as resection. Lobectomy, complete body part, or in the colon, any body part completely or entire colon also resection. Clear? Like nephrectomy, appendectomy, cholecystectomy, pancreatectomy, splenectomy, or upper lobectomy, or sigmoid colectomy, all should be resection. Okay. Any doubt? Excision, resection definitions?
No, sir.
One thing, Shiva, our removal of appendix is resection, right?
Correct. Complete body part removal and appendix was a body part.
Okay. Yeah.
So now we can discuss the examples for these two root operation related directly. First, I will give small root operations. Then we can go for the procedure wise. Okay. We can discuss one on one. First thing, liver needle biopsy lead. Lead everyone and note answers, guys. Don't tell me. Okay. I will give the answer. Just correct your answer correct or not. If it was correct, okay. If it should be wrong means ask me. I will explain. Okay. Don't tell me because everyone need to lead. No. If you lead, just note it.
Full code or just the root operation?
Everything you need to lead full code.
Okay.
Data operation everybody know, right?
Okay.
Complete code because you need to understand the book leading. No. Now onwards. Yeah. Lead the 6 codes.
The recording has stopped.
One doubt, sir.
Yes,
Sir.
yes, ask. Yes, yes.
For needle biopsy, they're not saying left or right, no, sir.
Liver, you can go take unspecified liver. They're not mentioned right, left. We have unspecified also, no?
First, it is search for biopsy or
Mhm.
Excision it will come, sir.
Yeah, correct. First, identify root operation for every procedure. Under the root operation heading, check the body part. Then only we'll get the code. That only I said first write index usage leading. Identify the root operation for each procedure first. Note down the root operations. Then start leading for under root operation heading body part.
So esophagus biopsy performed by the EGD entails, sir.
EGD definition you need to understand. Esophagogastroduodenoscopy. See, whatever we are telling in the class, just 30 to 40%. Remaining 60% you need to put efforts, guys. ఓకే మీరు చెప్పిందే చదువుతాము మీరు ఏం చెప్తే అదే వింటామంటే అవ్వదు గుర్తుపెట్టుకోండి ఓకేనా you people also need to put your efforts, then only it will work out. Do some own workout also.
Hi, sir.
Root operation మాత్రమేనా సార్?
Every complete code I need, guys, because if you are able to find the complete code, I understood everyone able to lead the code. If just identify the root operation, how you will lead the code in the book? I am expecting book leading everyone today. That's why I am giving the examples. Who are not able to find the code in the book, stay, I will explain and I will clarify how to use the book, because daily I can't able to show for each procedure in the book leading. You can show that procedure, you can show this procedure. A lot of people will ask, they won't lead, they will questioning. You can lead, I will show. What you will show? It was not movie, right? You need to practice the book leading yourself. That's why I given the examples. Lead the complete course. Who are unable to lead, please ask me, I will guide you, I will help you to leading. Okay, without leading, without preparation, simply sitting, ideally don't sit. At the ending, you people will ask all the things. Who are not practicing now, at ending you people will tell, I don't get that question, I don't understand this question, you can teach me now, I don't have time. People remember, if you one person don't have time, how can I put for the time for 140 members individually? So stop 1 hour Insta Reels or YouTube, practice this and pass your exam. For yourself, I am telling. If you pass means I don't get anything, you will get your certificate. Okay. So if you have any doubt, you can clarify immediately. Do after 1 month, after 2 months, I didn't understand anything. Don't tell me like that. And join the regularly classes also. these 6 questions today ending, okay? Whoever lead it, we can discuss. Who are unable to identify a code in the book, I will explain. Book leading, I will complete by today, because tomorrow onwards we can go directly root operation explanation. That's it.
Sir, after finding the root operation, we should look for the index, right?
Yes, first identify the procedure of root operation. Under the root operation heading, look the body part where they are performing the procedure.
Sir, I'm from Maple Months batch. I have a doubt.
Oh, yeah, ask now.
I have doubt regarding the obstetrics topic. I attended the PCS mock.
No problem, we can discuss. OB was delivery related, okay?
Yeah, I don't know how to take the code
In
regarding.
delivery heading, you will get directly.
Yeah, I attended the question, but I chose the wrong answer, I guess, and there was no rationale in the question.
No problem. We can discuss later, okay? After
When-
completion of the class today only, I will clarify, okay?
Okay, sir. Thank you.
Otherwise, you can do by tomorrow morning these questions, guys. Note down at least. You can practice tomorrow morning, okay? It was easy.
Sir, can you
can discuss.
explain one
Yes, sir.
first one alone, like how to lead enter completely?
Yeah, no problem. One question I will show. One question again I will show. Okay, from tomorrow onwards, don't ask me each question you can lead. I will show like that.
This meeting is
You
being
people need to
recorded.
understand the book leading. I seen lot of people. You can lead. I will show. You can lead. I will show. If you show means you don't get anything, because I will lead easily. I know. If you watch while you are watching, it was very easy. First, liver needle biopsy. What is the root operation?
Excision, sir.
Excision.
So
Needle
first
biopsy.
root operation should be excision. Now, how we need to lead? You find the root operation head excision. Go everyone excision heading in the book. In index. Under excision, liver. If you find in the liver multiple options, right, left, liver. If they not mentioned right, left, so we need to go with unspecified. Anyone find in index liver?
Yes, sir.
0 F
CRF B4.
4. Huh?
No, yes. 0 F B ఉంది సార్ అక్కడ ఇండెక్స్ లో.
0.
Yes.
No. I'm showing everyone. This is the book. Index. We need to go excision. C series. C series na. Excision. EX. Under excision, liver, right?
But
Liver,
one thing,
liver.
Shiva, can you go by biopsy since it's a needle biopsy? Can we just start with biopsy?
If you go with biopsy, you will get show. 1 minute, I will show. If you go with biopsy, what will happen? So up to now, 0 FD 0 you find, right?
If I go by biopsy, it comes 0F9.
That's why I am telling. That's why I said already how to lead a correct code. If you are going your own route, you don't get the code. What can I do? That's
Because
why
of
I
needle
said starting. That only I said starting itself. Do not do unnecessarily different options. You will get wrong options. Okay. Under the root operation heading, if you find the body part, it was easy method. I will tell if you go biopsy and all what will happen. Directly if you go for the procedure heading, what will happen, I will show now. Everything I will show. How we will go wrong. 0 FB 0 you find right here. Liver. Now we need to go for the 0FB series. Zero FB here only 0F. 367 onwards 0F series start. So here 0F1 I need B, right? I'm going next pages 5, 8 only in this page. 0F9 0FB. Zero FB 0 up to here I found, correct?
Yes.
In the two tables we have 0, correct? Yes or no, guys? In the two tables
Yes,
we
sir.
have 0, right?
Yes.
Now come to the approach. What approach they mentioned here?
Percutaneous.
Percutaneous for excision.
It is so percutaneous 3.
3.
Then Z.
No.
If you take in the body approach in this table means we need to take remaining characters also in this table only. We should not cross the table. Okay?
Diagnostic.
You should not cross the tables while you are leading the code. Suppose if
Okay.
you are taking the approach, you need to take the device and qualifier also in this row only. The given the line means the table was end. We should not cross the lines. Then sixth character, no device. In the seventh character, we have diagnostic and no qualifier. What we need to take? Diagnostic or no qualifier.
Diagnostic.
Diagnostic.
Then 0FB 03 Z
X.
X.
Now you don't know the root operation. You are going directly biopsy. Based on the procedure term you are going. Okay, you are not remember the root operation. You are going directly biopsy heading. See here what they mentioned under biopsy.
See the diagnosis, drainage.
C drainage, C excision, C extraction. Because biopsy procedure they will perform in the three root operations, not only excision. While they are doing the drainage also they will take the biopsy. Biopsy means just sample collection. Under extraction also they will take the biopsy. So if you don't know, right, what is the exact root operation here? That's why I am telling. Okay. If you go the procedure wise, if they will tell, see somewhere, see this where, see that. All the procedure same like that only they will tell. Suppose next I will show cholecystectomy laparoscopic, correct? What is the root operation?
Excision.
Resection, sir.
How it should be excision?
Resection, sir.
Resection, right? Complete body part they are removing. Now where they are removing portion? Resection. Under resection, cholecystectomy means, ectomy means removal. Cholecystectomy means removal of
Bile and urinary bladder.
gallbladder, madam. Not bile. Gallbladder.
Okay.
Chole means gallbladder, okay? Chole means gallbladder. Prefix. Gallbladder. Now, you don't know the resection gallbladder. Just you are going cholecystectomy in heading.
2 others.
1 minute. So, you don't know the root operation. You are finding the cholecystectomy in procedure note. You are going with cholecystectomy heading. What will happen? I will show. Cholecystectomy, CHO. What they mentioned here? C excision gallbladder, C resection gallbladder, correct?
Yes.
Yes.
If you don't know the meaning of excision and resection, what you will take? Both they given under cholecystectomy. Excision, resection, 0FB4, 0FT4. If you don't know the meaning of excision and resection, how we will get the complete code? Correct?
Yes, sir.
That's why I am telling. If you go the procedure term wise, it was very difficult. See all the things they will tell, see somewhere, see this way. These are the root operations only they will tell. Rather than that, identify the root operation, go with the root operation heading. It was very easy. If I don't understand the root operation definitions, I don't follow the root operation words means I can't able to do anything. It was very difficult method to go based on the procedure term. To go the procedure term, you will get some hints. That's it. You won't get correct procedure directly in the index. In the exam point of view, no need to use the index also. In the exam point of view, no need to use the index also. Okay, well, here just for practicing, I am showing index usage. For exam point of view, no need to use the index also because all are options. Directly we will go with the table and recheck the correct option. That's it. Under resection gallbladder. Then laparoscope means
Percutaneous endoscopic.
4 value. Here you find 0 FT4, then 4 percutaneous endoscopy value. No device, no qualify. Open splenectomy
Hand
also.
Hand assisted means G.
They mentioned hand assisted, we need to go with hand assisted. They not mentioned, no?
Okay.
If they mentioned, then only we need to take, okay? Same, open splenectomy means, what is the root operation?
Resection.
Resection. Guys, I am giving the example for your book usage, okay? If you read in the book, you will get book usage. If I will show, you don't get the book usage. That's why I am giving the examples for you people. Simply I am not giving. సో ప్రతి ఒక్కరికి బుక్ యూసేజ్ అర్థమవుతుందనే ఎగ్జాంపుల్స్ ఇస్తున్నాం. మీరు ప్రాక్టీస్ చేస్తే మీకు బుక్ లీడింగ్ వస్తుందనే ఇస్తున్నా. నేను చూపించడం నాకు నిమిషంలో పని. చూసేటప్పుడు చాలా ఈజీగా ఉంటుంది. ఇట్ వాస్ వెరీ టు ఈజీ టు వాచ్ హౌ ఐ am leading. While you are leading, again you will face problems if you are not practicing the leading. So everyone try to lead. If you have any problem facing issue, I will solve it and I will help you. If you are not asking anything now, at end of the time or after the exam, lot of people will text, I am unable to lead the PCS, sorry, I can't remember the things, sorry, I don't have time to prepare, sorry. Don't do like that. Please prepare, please prepare.
The recording has
Remaining you
stopped.
can lead, guys. Remaining questions you can lead. Tomorrow we can discuss if you have any doubt. So now stay who are having issue with book leading. Anybody have book leading issue? Please stay. Who understand the book leading? That's it for today.
Shiva,
Yes, yes, ask.
can you please share the soft copy of the ICD-10 CM book?
I already shared in the group and personally.
That is ICD-10 PCS.
PCS
only.
also I shared. PCS also I shared. One more time I am sharing in the group. Who are
CM
not.
book. Once
CM
again,
I
let me
shared
check.
and PCS also I shared.
It was shared already.
Before starting the session, I will share the material. Then I will start the session. I already shared the PCS and what I am going the guidelines, root operation heading guidelines book. Okay. Wednesday only I shared PCS new and CCS syllabus copy and PCS guidelines. 3 root operation guidelines. 3 PDFs I shared.
PCS book I have. Once again, let me check the ICD. CM book. Once
ICD
again.
already shared.
Oh,
Yesterday only shared. Wednesday only ICD 10 CM sequence rule, ICD chapter and ICD videos to watch and ICD mock test also I given. I given 2 videos of 3 hours ICD practice for, okay, how we need to go with guidelines. And I given 60 marks ICD exam. No, 1 or 2 persons only given result. No one done the exam. Remember, I don't book the exams without your mark test till the scores.
Where should we share the results, sir?
Which one?
The ICD test. I should
Wednesday
tell my
only I
marks.
said. I said 10
For
worksheet.
No, after finishing, should I inform you like that?
You can inform me. I will give the answers. You can cross check your score. Okay.
Okay.
Because if you cross check enough for me, okay, if you get good score, okay. If you are not good, you will understood right where you did mistakes. That's it. I don't want your scores. I will give the answer key once you done. It was not school now. If you copying, I don't get anything. If you get good score here, what is the use? Okay. Everybody understand the book reading? Or still anybody have issue with book reading? Class was over, guys. For having issue with book reading, ask me. I will help you. For not having issue with book reading, we can do that practice questions. Tomorrow we can discuss. And we can continue remaining root operations.
Thank you, sir.
Thank you, guys. Bye-bye.
Sir, can I collect the ICD PCS books from institute?
Yeah, why not? If you pay the amount, you can collect for Xerox books.
Sir, that
How much
obstetrics.
will be the amount?
Only PCS 600, all 3 books 2000. Once you done, if you refund, we can provide back 1000 rupees.
And we can carry the same books for the exam also, sir.
It was not useful for the exam, it was just for practice. Original books we need to carry. Originals I will give before the exam day.
Okay, sir. Thank you, sir.
If you need to practice the all ICD, CPT, PCS Xerox books, you can collect in institute. It should be 2000 rupees. If you don't want, if you refund in the institute books, we can pay again 1000 rupees back, not full amount. Half amount we can give back. If you can keep with you, you can keep. If you manage with soft copy, you can manage. Before the exam day, we can provide original books.
Sir, obstetrics question.
అడగండి ఆబ్స్ట్రిక్స్ ఎలా లీడ్ చేయాలని అడిగారు కదా మీరు.
Can I share it with you on WhatsApp, sir? My doubts.
No problem. You can ask me. OB procedures, right? You have doubt?
Yes, sir, from the mock test.
No issue, whatever. We can understand the concept. It will be easy rather than the question clarity. So if they done any procedure delivery, what they given in the index, check first delivery. Here they given C-section, manual assisted, vacuum assisted, forceps, C-section. They given C extraction products of conception. Forceps C extraction products of conception. Manual assisted directly you will get 7 digit. Vacuum assisted
is vaginal delivery, right, sir?
Manual assisted vaginal. Correct. Normal delivery should be manually assisted.
Okay.
Okay. Suppose vacuum assisted C production of conception 10D0. Here only you are getting 4 digit, right?
Yes, sir.
Now don't go again index. Directly you can go for this code. Okay, what?
Okay.
10D0 you can go in the table of contents. One zero series 60. 102A-D. These are the procedures for delivery related. Okay. Now, check what approach they using. Okay. Via natural or artificial opening. means vaginal. Open means they will cut the abdomen area.
Okay, sir.
Percutaneous endoscopy, laparoscopy. Then this is the scope, vaginal scopy, hysteroscope something.
Okay, sir.
Then they are not using any device. Then higher, lower, extra peritoneal, or vacuum assisted, or high forceps, mid forceps, low forceps. They will give clearly how they're done.
What does this high, low, and extra peritoneal mean, sir?
That pressure
Okay.
while they are performing the C-sections or forceps, what they are using, they will give here.
Okay, but in the question which you gave us, nothing was mentioned. So I got confused on which option to
But
select.
in exam, actually, the procedure definitely you will get. Okay, that question might be part. They missed the part.
Okay, so these are all the pressure part.
Definitely they will give everything in the procedure note.
Okay, sir. What is the difference between products of conception and products of conception retained?
Retained means, what is the meaning of retained?
To gain,
Normally, generally tell me retained means.
Gaining.
Not gaining. Retained means place in the. It was not completely.
Okay.
So parts was left in the body. It should be retained.
Okay.
Suppose they done abortion. Retained products means some parts are again in the body.
Okay, so this will come
Retained
under
means the place
miscarriage.
in our body. It was
Okay.
not come outside the body.
Okay.
It should be retained. Suppose while they perform the procedure, they put some scissors and all. Retained foreign body means they forgot in our body. It should be retained.
Okay, sir.
Yes.
I also have one more doubt in the ventilator question, sir.
Ask him. Simple. Ventilation means you will get 5A1D, right?
Yes, sir. Actually, the second PCS code was OBH7EZ.
That was in this one. Endotracheal tube insertion.
ET tube, sir.
ET2. You have doubt in ventilation or ET2?
ET tube, sir.
Okay. What is the doubt in ET2?
OBH7EZ. I don't know how to find that PCS code, sir.
What is the root intubation? Root operation? Suppose. What is the root operation for intubation?
Insertion, sir.
Insertion. Then where they are inserting? Endotracheal. Trachea, right?
Yes.
Under insertion, trachea.
Okay.
Same. Like this you will get procedure, okay? Same respiratory ventilation, endotracheal intubation.
Okay.
Okay. Intubation or ET tube insertion, same only, okay?
Okay,
Under
sir.
intubation, trachea.
Okay.
Where they will insert the endotracheal tube in our body?
Via mouth.
Mouth. So what approach you will get? Via natural or
Right.
artificial opening, 7.
Yes, sir.
Then approach should be endotracheal airway.
Okay.
Then no device.
Can you just lead and show me, sir, for one time?
Up to index you lead it.
Okay.
You lead it, right? Or
Yeah,
you
yeah,
can't
sir.
able to lead
I'm
in index.
sure with the leading part in the index, sir.
Just you need to confuse in the traveler list.
Yes, sir.
0B1 to 0BY. 0B1. BH, right? We need
Yes, sir.
BH1. See here, we have 4 options, correct? 1. So where they are inserting endotracheal tube?
Mouth.
Mouth. So this table you need to find.
Via natural or artificial opening. Okay.
Then endotracheal airway.
Intralominal device. Okay.
Endotracheal airway. Endotracheal tube row. So endotracheal airway.
Okay, sir. Okay. Thank you, sir.
Then anybody have doubts, guys?
లాప్రోస్కోపీలో మనకు ఇండెక్స్ రాసి సార్ 084 ఇప్పుడు టేబుల్ ఆఫ్ కంటెంట్స్కి వెళ్ళిన తర్వాత ఇప్పుడు ఆ 3 కోడ్ దొరుకుతుంది సార్ మనకి
అర్థం
టేబుల్ ఆఫ్ కంటెంట్. ఇది లాప్రోస్కోపిక్ కోలిసిస్టెక్టమీ సార్.
ఇండెక్స్ లో 0FT4 వరకు లీడ్ చేశారు, అవునా?
అవును సార్.
అప్పుడు ఏం చేయాలి మీరు? ఇండెక్స్ టేబుల్ కి వెళ్ళలేకపోతున్నారా ఏంటి? డౌట్ చెప్పండి.
టేబుల్ కూడా వస్తున్నా. టేబుల్కి వచ్చి 367 పేజ్ నెంబర్ నాకు దొరికింది సార్.
ఆడి వరకు వెళ్ళి ఆడికి ఆగిపోయారు.
ఇక్కడ ఆగిపోయాను సార్.
ఇక్కడ చూడండి, మీకు 0F1 ఉందా టాప్ లో?
0F
ఏముంది చెప్పండి మీరున్న పేజ్ లో?
అంటే నేను ఇన్ బిట్వీన్ చేస్తారా అంటే ఒక్క నిమిషం సార్.
వాట్ ఎవర్ ఇట్, సపోజ్ ఇప్పుడు చెప్తాను వినండి. మీరు ఓపెన్ చేసిన పేజ్ లో ఇలా ఏదో ఒకటి వస్తుంది కదా, టాప్ 3 డిజిట్.
అవును సార్.
సో మీరు ఫస్ట్ చూడండి ఏముందో అక్కడ. 0D సిరీస్ ఉందా, B సిరీస్ ఉందా, F సిరీస్ ఉందా, G సిరీస్ ఉందా? సెకండ్ క్యారెక్టర్ చూసుకోండి. సో ఫస్ట్
న్యూమరిక్ నెంబర్ ఉంది సార్.
సెకండ్ వాల్యూ.
అవును సార్.
రాడు కాదు, న్యూమరిక్ ఉంటే అప్పుడు మీరు లెటర్ కోసం రావాలి కదా.
అవును సార్, ఆల్ఫాబెట్ కోసం రావాలి.
అంటే యూ నీడ్ టు గో విత్ ఫార్వర్డ్ పేజెస్. ఫస్ట్ విల్ గెట్ ద నెంబర్స్ ఇన్ ద సెకండ్ క్యారెక్టర్ ఇన్ ద సీక్వెన్స్, దెన్ లెటర్. సపోజ్ D లో ఉన్నారనుకో, అప్పుడు F కి రావాలంటే ఇంకా పేజెస్ మూవ్ చేయాలి. ఇప్పుడు F వచ్చారు. F1 ఉందా ఇక్కడ? థర్డ్ క్యారెక్టర్ అండి. F వరకు లీడ్ చేశారు, మీకు FT కావాలి. ఇక్కడ 1 ఉంది, అవునా? 1 తర్వాత మీకు ఏమొస్తుంది? 2, 3, దెన్ ABCD లైక్ AT అలా సీక్వెన్సింగ్ లో ఉంటుంది థర్డ్ క్యారెక్టర్. F2, 5, 7, 8, 9, B. ఇక్కడ టాప్ లో చూసుకోండి, సైడ్ లో మీకు ఏ పేజ్ లో ఉన్నారో తెలుస్తుంది. ఇక్కడ చూసుకోండి, ఓకేనా? ఈ పేజ్ లో 0FD, FH వరకే ఉన్నాయి. మనకు కావాల్సిందంటే FT, JLA ఉన్నాయి, MNA ఉన్నాయి. సో ఇక్కడ PQA ఉన్నాయి. ఇక్కడ ఉంది FT, 0FR2, 0FT, then liver 0, Z0. Suppose they are given cholecystectomy. What is the cholecystectomy value? 4. Gallbladder 0FT4. Laparoscopy means percutaneous endoscopy. No device, no qualifier. Because they not mentioned hand assisted. If they mention hand assisted, you will go with hand assisted. Suppose they given only cholecystectomy, 0ZZ. Thank you. Thank you, guys. Yes. అడగండి ఫాస్ట్.
ఐసిడి కోడ్స్ ఎన్ని వస్తాయి సార్ మాక్సిమం ఎగ్జామ్ లో?
PCS CM అండి?
ICD-10 CM కోడ్స్ ఇచ్చారు కదా మీరు.
ICD-10 CM చాలా ఉంటుందండి. CM సగా 200+ మార్క్స్ ఉంటుంది. ఎగ్జామ్ అంతా ICD-10 CM కదండి, PDX, SDX.
ఓకే.
అప్పుడు ఎన్ని వస్తాయి మీకు గుర్తుపెట్టుకోండి. 30 మార్క్స్ ఈచ్ కేస్ స్టడీ అంటే 180 మార్క్స్ కేస్ స్టడీస్ లోనే ఉంటాయి CM లో. దెన్ మల్టిపుల్ చాయిస్ కూడా 20 దాకా వస్తాయి CM నుంచి. ICD CPT PCS కన్నా 10 CM మెయిన్ అన్నమాట. 10 CM who will understood, they can easily pass. CPT PCS hardly 5 to 10 codes you will get in exam. You can write in the paper also easy, but 10 CM main. That sequencing rules, everything.
You say more than PCS, ICD-CM is important, right?
Yeah, more than 240+ score you will get in the CM, because PDX and SDX 30 marks right each case study. That should be ICD course, right?
Okay.
So sequencing rule we need to follow. Okay.
Fine.
ICD-10 CM.
Yeah, but one thing about the liver needle biopsy you mentioned, where I got confused. Na? It mentioned only about needle. It's not about core needle or fine needle. So I took that fine needle. That's a confusion.
Yes. Fine needle drainage. Okay, wow.
Fine. So we should be going for excision only, right? In that case.
I will tell you at the time of drainage route operation that and all. Okay?
Fine.
సార్ ఎగ్జామ్ లో anatomy నుండి ఎన్ని క్వశ్చన్స్ వస్తాయి సార్?
0 అండి. We don't get single anatomy question in exam. Just for understanding of the PCS body parts, we explain the anatomy for freshers, and it will useful for your interviews.
Okay.
In exam point of view, don't get single anatomy question. It will useful for your interviews and understanding the PCS and all. Okay. No doubts, right? So 40 people were staying. Ask me fatafat guys, doubts you have, otherwise left now. I'm waiting for your people, you only. Anyone will ask, otherwise I will close the session. No doubts means fatafat exit guys. Or ask fast.
సార్ రికార్డింగ్ సెండ్ చేస్తారా?